I was recommended by both my OBGYN and my oncologist.
Okay.
Yeah, I was told to save embryos before I went into chemotherapy. It was a very it was a scary time because we weren't sure what the prognosis was at that point. So to be honest, I was it was another surgery and another process I was going to have to go through. So at the time, I was really hesitant to go through with it, and I'm so glad I did. It was one of the best decisions I've made. So it was, but at the time it was scary because it was, we wanted to hurry up and get everything taken care of. As far as I was told I needed a double mastectomy, there was reconstruction involved, there was chemotherapy, so there was a lot of things that I needed to go through first. And then just thinking about where am I going to be in 5 years anyway. But if I wanted hope, I was told that it was a good idea to go ahead and save embryos. And so I'm really glad I did. I mean, we did a procedure called IUI, so intrauterine insemination. We did one attempt and it worked on the first try. So we had great success with that. And then once we got the okay, all clear from my oncologist, we had a meeting with Dr. Arnold, and we got the ball rolling as far as getting me on a program. There's things involved like hormones, injectables, things like that to get your body ready for the frozen embryo transfer. We went straight to IVF because there was my age. I'm currently 41 years old, so my eggs, or I guess the embryos, were saved when I was 36, and my husband was 4.5 years younger as well. So it made sense for us to go straight to IVF since we already had the embryos saved, and we could also genetic test them. One of the reasons we wanted to do the genetic testing was because I had a prior miscarriage, and it can rule out any abnormalities or things like trisomy 21, which I didn't really want to go through another miscarriage. So what happened was we had 10 embryos that were saved 4.5, 5 years ago, and of the 10, 3 survived the whole unthawing process. I think all of them survived the unthawing, but the 3 made it to the blastocyst. And then of the 3, 2 of them were abnormal, and we had 1 normal. So that's obviously the one we chose to transfer, and it was a girl. 21 weeks pregnant.
Perfect.
She's great because she does a really good job of explaining the process and just what to expect moving forward. There's a calendar that she goes through and just different scenarios to manage your expectations, and she was just very forthright in letting us know, similar people in our situation and the odds of getting pregnant and just your chances and statistics and things like that, but just explained the process very well. And obviously she was very excited that we were back and happy for us too. So it was a good experience. Anyone in this position really wants to know the facts and really what your odds are and the chances. And you can always have hope, but there's always something, you never know how many good embryos you have. There's just a lot of variables, but it was explained to us, so it made it easier to manage our expectations going into it. That's a hard question. I can't think of just one word because there's a lot of emotions that go into it. The thing that I always think about is hope. It's like through the whole experience is that you now have like this hope. We now had, so there's now that sense. So for my husband and I, we might be different than other couples as well, but we had an age factor. I am 41, my husband is 49, so he's 8 years older, going through the breast cancer. It was nice to have something to look forward to at the end of the breast cancer and getting through all of those health issues that I had. And for my husband and I, we wanted to know that we did everything we could do to try for a family. So it just gave us hope. So. Yeah, that's a good question. I didn't think a whole lot about it until my husband and I had problems trying to conceive. So at that point, I talked to friends that were in similar situations and also did research. And I didn't know a lot about it, so I had to research a lot of it. And for us, it made sense to initially start with IUI because it was less invasive, less hormones and things like that involved. But I came in at that point with an open mind thinking, oh, this could work. And technology has come so far. I didn't even know I had these options. So it was eye-opening. I would definitely say there are so many positives to it, and it depends on obviously each person's why they're having a problem conceiving, but medical advancements have come so far that I think it would be crazy not to try to get that help, since their technology has come so far, medical advancements. I mean, just to know that you can put in a healthy, a baby that will thrive and won't have the sadness of miscarriage. Obviously, you don't know exactly what's going to happen, but to know that you're putting in a healthy embryo, and to find out what is going on. I don't understand why people would wait and try for years and years with no success to find out there's just maybe one little thing wrong that could be fixed very, very easily by having a consultation and just to find out what might be going on. So there's a lot of pros, but I feel like everyone that we interacted with at this office was definitely an expert in their given field, whether that be Dr. Arnold, the nurses, the endocrinologists, if I'm saying that correctly, I think it is. But everyone with their specialty was definitely an expert, and I fully trusted that they knew what they were doing. And okay. I would say the con is, and it's not just given this practice, it would be anywhere, but you really do have to manage your expectations because everyone is so different, and you also have to be very flexible because things can change and your body might not react the way it's supposed to, or you might take a little bit longer, or maybe your embryo doesn't unfreeze in a timely manner, or you don't get the genetic testing back in time. I mean, there's just so many variables that I would say keep an open mind and be flexible and just trust the process. Sorry. Thank you, because I didn't think this was possible, and it changed our lives, and it really gave us hope that we could have a family, which, you know, we didn't know for a while if I would be here. So I just thank you. Thanks for being an expert at what you do, and giving us this opportunity.